Okay, so we're getting into the elbow now. Start out with some elbow fractures, then we'll talk about tennis elbow. So just generally speaking, this is kind of just general stuff. Don't need to know this really in depth at all for the midterm. With the elbow, direct impact with the outstretched extended elbow usually involves the radial head fracture. The elbow is flexed, bent, usually gets some kind of dislocation. Direct impact to the elbow usually results in fracture of the olecranon, that right in the middle of that bone that sticks out. Major concern with the elbow injury is loss of extension. It gets contracted, gets stiff very, very fast. Generally immobilized at 90 degrees of flexion. So that can lead to lots of problems, being in that sling, being immobilized. Elbow dislocation generally occurs as a result of hyperextension. The most common result of this injury is loss of extension, usually with the elderly. And it kind of progresses, shows you how much they lose over time. Some dislocations are stable, others are unstable. Those that are unstable may require surgery. Okay, so this is the big thing here. Tennis elbow or lateral epicondylitis. Your lateral epicondyle, this is right here. All these wrist extensors attach right here. This is where you get the tennis elbow, lateral epicondylitis. It gets really, really sore around the lateral epicondyle, or this extensor muscle belly here. There's the olecranon. You can see where they're attaching there. Very common thing. You'll see a lot of this in outpatient clinics. In other settings, tennis elbow. With tennis elbow, people are 3 to 4 more times more, 3 to 4 times common than medial epicondylitis, which is golfer's elbow. It's kind of on the other side of the elbow. Usually there are over 30 most patients. Kind of radiates distally. Pain is present with activities. Could be tennis, but more commonly it's throwing, lifting. I used to see a lot of people with carpenter, hammering, drywalling, painting, just repetitive, forceful wrist motions, especially wrist extension. See how he's doing that kind of the wrist extension as he comes up and down. That's what Cinderella's doing. It's causing her problems. So you could probably guess this is probably what she has. Repetitive, forceful gripping, which is twisting of knobs, associated with racket sports. Can also occur in other sports such as swimming, fencing, throwing sports. Any sport where they're really kind of working that wrist hard. With the tennis elbow, the pain is described as a constant ache with episodes of sharp pain, which cause person to lose their grip. Usually weakness, they'll have weakness with the wrist extensors that go with it. Usually a gradual onset. Usually begins like as a micro tear of the extensor carpi radialis brevis. Then there is repetitive microtrauma, which leads to fibrosis and formation of inflammation. When you examine, when you kind of follow, you do your Cosen's test, we'll talk about it in a minute, and you follow that up with your thumbs. Usually it's pain, tenderness right over the lateral epicondyle. That kind of confirms, okay, now we're talking tennis elbow for the most part here. May have restrictions of elbow range of motion during extension. The Cosen's test. Here it is right here. So you just kind of resisted elbow, extend your elbow, and then you extend your wrist, and you resist that. Come do like a minute muscle test, and you should feel pain. So if you palpate around that lateral epicondyle. There are other tests. There's the middle finger test, which is positive. It's also for radial tunnel syndrome. And really, anything with resistive wrist extension will make this hurt if it's tennis elbow. The ones that I saw, it was so inflamed. The second they extended their elbow and just extended the wrist without any resistance, it would hurt. So you get pretty sensitive. Treatment-wise, we'll look at the treatment box in a minute. Doing a lot of manual therapy right down the condyle itself. These counterforce braces kind of roll back the other way. They can be very helpful as well. Okay, so let's see if we can jump to the treatment box here. There's the stuff FYI for the trauma, and then here's the stuff you definitely need to know for the exam around tennis elbow. Shows you the test, the Cosen's test. with the palpation, following it up. Initially, what do you want to do right off the bat? Just kind of calming it down, stretching it out. Aerobic exercise is going to get flow going, resting it. Just basically stop doing the motions that are making it hurt. Adapt equipment. OTs are great at adapting equipment, making the handles larger, that sort of stuff. Modalities. ICE is good, right over that lateral epicondyle. Pulsed ultrasound to those wrist extensors can be really helpful, reduce the pain. Kinesiotaping, we'll do that. We'll show you how to tape for tennis elbow. Gentle isometric, gentle extensor stretch, eccentric contractions. Talk about that in the lab. It's kind of hard to explain what do I mean by an eccentric contraction. Sort of flex to stretch those extensors, those wrist extensors. If you extend your wrist right now, feel that, that muscle belly kicking in. You stretch those by going the opposite way. So you stretch the extensors by going into flexion. A flexion with your wrist, with your elbow. So extend your elbow and flex your wrist. And I can feel those wrist extensors stretching. Eccentric contraction is if you just take your wrist over the edge of a chair or over the edge of a desk, you have a weight, and you just drop it down. You're basically flexing it. That's an eccentric contraction. A concentric contraction would be extending your wrist with the weight. This you're going to have to see to kind of get it. Taping. Mulligan glides is a really, really effective treatment. I love this. It got all kinds of great results with it. A lot of good evidence behind it. I'll show you how to do this in the lab. Cross friction massage, 2 fingers back and forth, right over that lateral epicondyle. A lot of times I would ice it up, numb it up before I would do that. It can be painful, but it can be very effective. And then as you're kind of progressing along, as they're getting better, Mulligan glides, more strengthening, more range of motion, being more aggressive, building up the reps, that sort of thing. And you're kind of getting them back. And this is the last column, is just we're starting to get into splints and braces. Counterforce brace kind of rolls, get the lateral glide to that extensor belly, can help reduce the pain. Wrist cock-up splint, like this, keeping the wrist in neutral. It stops all that wrist flexion and extension, gives it a break. That can be helpful as well. And then let me just zip down here. This is kind of a down and dirty, a quick summary of how to do tennis elbow. It breaks it down, all the tests. This is the Mulligan glide, lateral glide. This is the eccentric contraction. She's dropping the weight down. She's flexing her wrist down. She's not extending it. She's just dropping it down. There's some more eccentric contractions coming down. He's got the weight, he's dropping it down. This little bar thing is kind of cool. You can kind of go back and forth with that. Can help. Mobilizing golf with the Mulligan again, which you need to kind of see to get. Alright, so let's kind of move on here. We're going to get into the others here.